can learn, we can transfer the information to, we can transfer the information to long-term memory if we make mnemonic. So we will try to cover more and more mnemonics in this chanting. So we start now anesthesia chanting. Okay friends, so most common question you will find that the color of cylinder, yes, that is oxygen cylinder. You know that oxygen, I relate oxygen as white, man in black, just like I am in man in black, DBMCI, e-Gurukul, yes, and wearing white apron. So oxygen, this is oxygen. So black body, this is black body, and white shoulder. Yes, you must have seen this oxygen cylinder many times. So black body, white shoulders. And if I say O2, 2000 pressure, PSI. Question is asked on the color of cylinder, pressure of cylinder. Now, nitrous oxide, you can simply remember in Hindi and for Neela. Nitrous oxide, yes, blue color cylinder. This is blue color cylinder, not this one. Okay. Now, Antonox, yes, I would like to correct it. Yes, this chanting is based on Dr. Ajay's notes, LMRP notes. Okay. So Antonox, ENTONOX. So if you count the letter 1, 2, 3, 4, 5, 6, 7, so you can easily remember that the pin index is 7. I will discuss, don't worry. For the time being, N2O plus oxygen. And you know N2O Neela means blue. Oxygen, I told you that oxygen you will consider related to doctor, white coat, white color. So oxygen, white color, I have already told you that white shoulder, black, man in black, just like me. Okay. So blue color, white shoulder, that is Antonox. This one. Blue color cylinder, white shoulder. Okay. So till now I told you that oxygen means white color. Yes, white color shoulder, man in black. I am man in black, you can say. Yes. Nitrous oxide, Neela. Antonox, N2O plus oxygen, 50% each. Okay. And that's why N2O blue color, oxygen white color. Now, pin index, frequently asked question. Okay, you will find so many things, you know, Sivalli and everything is there. Okay, don't worry. Pin index system. You will remember simply air. First, yes, I change the sequence for mnemonic. AIR, air. Air is one of the 5 element. Air, fire. Fire's flower समझा क्या? Fire है. So air, fire, these are element. How many elements? 5. And one element is air. So 1, 5. 2, 5. 3, 5. I can write like this. 2, O2. N2O. Till now we have discussed like this. So N2O, how many atoms? 3 atoms, 3, 5. O2, 2 atoms, 2, 5. AIR, first, 1, 5. Okay. Now, helium, heliox is made up of helium plus oxygen. And helium, if you have ran in 10 plus 2, yes, I think now voice is clear. Yes, helium 2He4, 2He4, so 2 4, so heliox 2 4. What is this pin index? Yes, sometimes yes, you are not putting these cylinder, you are doctor, you are not putting these cylinder on the anesthesia machine. This is anesthesia machine. Yes, this is anesthesia machine. We will not put cylinder ourselves. So what we made the pin in the machine and the hole in the cylinder, so that the distance between pin in the machine and distance at the cylinder is same. That's why every time these cylinder will fix at a defined position. So to prevent wrong fitting of cylinder, we have pin index symptom. You 5 element air, O2 2 5 and 2 3 4, heliox yes 2 4. Yes. Now other than that, you all know that carbon dioxide, when carbon dioxide comes, we immediately think about smoke. Carbon dioxide is smoke. The color of CO2 cylinder is gray color. Yes, smoke, gray color. Okay. Yes, so I write here CO2. As my handwriting is so poor, it looks like 6. 6 6 6, so C CO2 cyclopropane. So now you can remember the pin index 162636. Sorry, you can, yes, I can write it cyclopropane. So 162636. Okay, so cycle I have taken deliberately the orange color cycle, and yes, you will, yes, sometimes these colors will help us to remember things in exam. Okay, so orange color cyclopropane. And how many tires are there in cycle? 3 6. Okay, CO2 2616. If 1 plus 6 7, if CO2 concentration is more than 7%, then this is 16. If less than 7%, 26. Okay, so now you can easily remember the color of cylinders. Yes, that is gray color CO2, cyclopropane, that is orange color. Yes, C for vitamin C, orange is present in orange, you can remember like that. Okay, air, I, first element 5 1 5, O2 2 atoms 2 5 and 2 3 5 helium. Yes, now this is rotameter. Rotameter means the flow of gas. This is also having color coding. If I say this is blue color, yes, blue color is N2O, white color oxygen. Okay, and you can measure the flow. Yes, how much oxygen, how much N2O is being delivered. You can increase and decrease the flow of gas also by rotameter. It is attached in anesthesia machine. I will tell you this, anesthesia machine. Yes, flow meter is attached. Okay, now questions are asked on vaporizer. The color of vaporizer you will find, yes, that mnemonic is ये श्रीवल्ली, यस श्रीवल्ली बीड़ी पी रहा है. यस, ये बीड़ी पीता था ना. This was usually this used to smoke. Okay, but she could not do anything. Yes, so Shrivalli sevoflurane, that is yellow. I have taken the color also. Yes, so you will have yellow color sevoflurane, blue color BD, blue color dasflurane, पर्पल कलर पी रहा है, PI, yes, that is isofluoride, red color halothane. Okay, so she could not do anything, he is Saklonda, could not do anything, but yes, she was saying, oh, what can I do? Okay, I can't do anything. Yes, so sevoflurane, yellow, Shivalli, Shrivalli, Dasflurane, blue. Okay, BD. So now, so these are initial agent. These are frequently asked question that semi-closed circuit, Mapleson circuit. McGill. I say remember McGill as Maggie. Maggie. I means first. One. Maggie as one means single tubing. McGill's or Mapleson A circuit or McGill circuit, you will find a single tube. And when you eat Maggie, you enjoy spontaneous. That is spontaneous ventilation, and it's very near to. Yes, you must have eaten Maggie and very near. So expiratory valve near to patient. So this is patient and expiratory valve. So if you remember Maggie, you will remember all these things. You can't control Maggie. Yes, Maggie can't control. I can't control means contraindicated. Contraindicated in controlled ventilation. Contraindicated in controlled ventilation. This is spontaneous, expiratory valve near to the patient. Okay, McGill circuit. I first. Okay, Mapleson A. Pass means near to patient. Yes, spontaneous. You can't control, and the ratio of fresh gas volume and minute volume is 1. So 1 you will remember. So you can say fresh gas flow is equal to minute volume. Okay. Now, yes. Now this is single Bain circuit. Yes, you know Punjabi. Yes, in Punjabi we have Bandi. Okay, this is a very common, most frequent Kali. Okay, Bandi. And if a person is saying Bandi or another person, control Paji, control means Bain circuit. Mapleson D circuit. Bain D. D matlab die. Die means two tube. Yes, if they give picture to you, you will find two tube, one inside the another. This green tube inside this white tube. So this is bandy, die. Okay. D4 distant from patient. Expiratory valve. Yes, Mapleson A matlab pass yes, near to the patient expiratory valve. D distant from the patient. Yes, these two tubes are there. Yes, and the ratio is near about 2. Yes, how to remember? Yes, in controlled ventilation or control means it is controlled ventilation. Then 1.6 less than 2. If spontaneous ventilation more than 2.5. Yes, so means if fresh gas flow is 1.6 in controlled ventilation, we will prefer it for controlled ventilation. Clear? It can be used in spontaneous ventilation, but the flow of fresh gas would be high. Clear? So this is most common. Yes, I told you most common Gali. Yes, two tube, die, two tube distant from the patient. Sometimes you may find these types of picture. Yes, this Mapleson A means, yes, Maggie, pass that is expiratory valve is near to the patient, while Mapleson D, expiratory valve is distant from the patient. While BC, Mapleson B and Mapleson C, these are BC, bakwas. Yes, leave it, not used nowadays. What about Jackson? These is Mapleson F. I raise T piece methylson E. So you can easily remember I raise E as methylson E. I raise E as methylson E, and you know Aya. This Aya means these two are used. These two are used for children. Okay. Sun, you can easily remember Aya for sun. Yes, IRA E methylson E, and Jackson F methylson F. So this is about this. So questions are asked on this vaporizer color. Yes, questions are asked on this circuit. In circuit, McGill A, Maggie, you will remember one, and Bandy, yes, di 2 coaxial tube. Okay. Now I move to next slide. Yes, few history. Yes, little bit conceptual. You all know that anesthesia, if you want to do surgery, yes, we gives anesthesia, and the first person was W.T.G. Morton. Yes, we will remember Morton. Yes, you must have seen that Morton, after smelling Morton, the mosquito become unconscious. So do you think that anesthesia is only unconsciousness? No. Anesthesia is not only unconsciousness, but we found that ether is a complete anesthetic agent, and this W.T.G. Morton, William Thomas Green Morton, first demonstrated ether for, yes, anesthesia. Publicly he demonstrated on 16th October. That's why 16th October is celebrated as World Anesthesia Day. How to remember? Yes, if you want to sleep, then you will use Mortin to, yes, save yourself from mosquito. So सोने के लिए, so in Hindi, sorry for that who can't understand Hindi. So yes, sola, soja, sole. So O, only 1 month is having O, October. 16 October is World Anesthesia Day, and Morton demonstrated ether. So I told you that ether is complete anesthetic agent. Means, what does it mean? Anesthesia doesn't mean that only unconsciousness, loss of consciousness. Means if you want to do surgery, there should be no pain. There should be loss of reflexes. There should be no memory of that painful procedure or that procedure, amnesia. Muscles should be relaxed. Okay, so these are the component of anesthesia, and we found that when Morton showed that all these components were present in ether, but ether is not used. It is inhalational agent. It is irritating, and there are chance of blast. Okay, means inflammable. So that's why not used. Then we found that there are so many anesthetic agent, but no anesthetic agent is complete. Means these anesthetic agent can't provide all these component of anesthesia. Then John Lundy came and say these 5, yes, you can use multiple drug. You can use multiple drug to achieve the 5 component. Means you can balance. All components should be mixed and you can give balanced anesthesia. So concept of balanced anesthesia was given by John Lundy. Yes, that is Johnny Lever. Okay, at least you will have idea. Now you know the concept. So Morton, you know, yes, Soja, 16 October, yes, Soja. A question was asked recently. You are doing lumbar puncture. Last structure encountered. Yes, in lumbar puncture we take CSF from subarachnoid space. We take from subarachnoid space. So last would be arachnoid matter. So last should be arachnoid matter. And in spinal anesthesia, we give anesthesia at subarachnoid space. We give anesthesia at which place? Subarachnoid space. Clear? And this was first discovered, yes, demonstrated, done by August Beer. Yes, when you Google, you will find so many names similar to. There was a person, August Beer, and I found the Beer, yes, B-I-E-R, yes, August, B-I-E-R. Okay, August Beer demonstrated spinal. So question can be asked, in spinal anesthesia, where you give? At subarachnoid space, where lumbar puncture? Subarachnoid space. So last structure which is perforated, arachnoid matter. Okay, so epidural, yes, is given epidural space. So we found that spinal anesthesia is very rapid because it will dissolve in CSF. So it is very rapid, while epidural space you give, it is slow. Okay, so we will discuss it later. For the time being, yes, we say this is anesthesia, few component. Now questions are asked. Yes, in anesthesia, how many steps? First is induction, maintenance, and reversal. But before induction, what we do pre-oxygenation, because to replace nitrogen with oxygen. After that we do, yes, induction. Yes, we said that John Lundy said that we can achieve all these things by multiple drugs. So let's try. We want analgesia, opioid, you all know. We want amnesia, we give midazolam. We want anesthetic agent, loss of consciousness, propofol. We want muscle relaxation, suxamethonium, rocuronium. Then you can intubate. Okay. Now you found that induction is usually IV. We maintain, yes, what is induction? Means from consciousness to unconsciousness. Patient is conscious, I want to make the patient unconscious. How can I do? I will inject one thing, or I put a mask and give some inhalational agent. You can give inhalational agent to child. If a child is there, then we can use inhalational agent to avoid the cannula. Otherwise, most commonly, yes, induction is IV. But maintenance is by inhalational agent, N2O and O2. Yes, and reversal by neostigmine and extubation. I consider that you must have done this. Now, intravenous agents, yes, all the questions you can easily do by the name itself. Thiopentone. Tone 10 means it is having alkaline pH near 10. It is having half-life around 10 hours, but its action lasts shortly. What is the reason? Due to risk distribution. Means you are giving intravenous agent thiopentone. Thiopentone is ultra soft-acting benzodiazepine, and you all know benzodiazepine is inhibitor of GABA receptor. Yes, activate GABA and inhibit the CNS, brain suppression, so increase metabolism of brain. That is why it is cerebroprotective. Again I repeat, it is cerebroprotective because benzodiazepine act on GABA receptor and cause CNS depression, so CNS metabolic rate is decreased. And benzodiazepine are having anticonvulsant property. Yes, you all know that in seizure we give sometimes IV benzodiazepine. Okay, many times you know. So thiopentone, pain as pain. Normally it is not painful, but if you give intra-arterial injection, then it become painful. Yes, it is by fault. Yes, you know, at anterior cubital fossa, if you give in intra-arterial injection, then intravenous, it can by accidentally go to artery and it would be very painful. Now propofol, very very important. Every time, yes, question is asked, you can easily remember fol, propofol, ol. Ol means alcohol. Yes, you know alcohol. Yes, vodka. Yes, the color of popular. Yes, propofol is actually diisopropyl alcohol. Propyl alcohol, propofol. Yes, when you take alcohol, you always take chakna. Sometime you take soya chap, soya chap. Sometime you take egg. Okay, so in this, yes, prepared in soybean oil. And whenever any injection is oil based, that is painful. When it is having so less egg lecithin, so there are chances of bacterial contamination. That's why we say that whenever bacterial contamination is there, yes, if you open the vial, you discard it in 6 hours. Discard in 6 hours. What about other points of propofol? Propofol, painful. Okay, yes, white in color. The color is white. This has euphoric effect. You all know alcohol is having euphoric effect. So this is best for daycare anesthesia. Now, half-life 2 to 3 hours. Half-life 2 to 3 hours. It has unique property of antiemetic. Okay. IV agent of choice, this is routine induction, daycare surgery. Okay, so in routine induction we usually use propofol. As I told you, propofol is used. Now there is one more IV, that is etomidate. On my date, yes, etomidate on my date. If you go on date, your heart would be satisfied. Yes, heart, cardiac stable, but your kidney may be solved. In fact, additional desire, yes, will be suppressed. Yes, adrenal suppression. Okay, so you can remember pocket would be suppressed or compromised, or you can say kidney sale कर देते हैं ना, you know कि kidney भी sale हो जाती है. Yes, now ketamine. Keta is kata. Keta is kata. Cut or dissociate. Cut or dissociate. So dissociative anesthesia. All the anesthetic agent are NMDA receptor. All anesthetic agent are GABA receptor blocker, but it is NMDA receptor blocker, ketamine. Okay. Advantage of ketamine is that it has sympathomimetic activity. It has which activity? Sympathomimetic activity. Sympathomimetic activity. Yes. So, if sympathomimetic activity, yes, I usually remember इस ये ऐसे याद रख लेते हैं. If you see the structure, chemical structure, you will find that it is phencyclidine like this, and this I usually say increase. Everything is increased. Intraocular pressure is increased. Intraocular pressure, intracranial tension, BP is increased. So BP is increased. Yes, bronchodilation occur. So ketamine has sympathomimetic activity. So bronchodilation occur. Yes, BP increase. So it is, yes, intravenous anesthesia of choice of shock patient, low cardiac output patient, but sympathomimetic activity, right to left shunt, tetralogy of Fallot, asthmatic patient, you can give ketamine. And when you think of dissociative word, immediately psychiatry comes in my mind, and never psychiatry comes in my mind, hallucination come in my mind. Yes, ketamine is associated with hallucination. So keta kata, dissociate kiya. If you see NMDA, what is NMDA? N-methyl D aspartate. Yes, you can say cut apart. Yes, so you can make many mnemonic for this. So this is about inhalational agent. Yes, sorry, intravenous agent. Now we come to inhalational agents. Yes, inhalational agent classification. Okay, it is inhalational are usually used for maintenance. It is used for maintenance, means you induced, after induction you maintain. Okay, classification. Yes, gases, N2, volatile agent, that is halothane, isofluorine, desflurane, sevoflurane, I have already discussed. Now the color I have already discussed. Now you can remember these like this. I have taken the color of, yes, vaporizer, that is red color for halothane, purple for isoflurane, yes, yellow for sevoflurane, blue for desflurane. And you can remember easily. Yes, how you can remember, let me tell you. Yes, first of all, before going to that, you must know inhalational agent. What we do when we do inhalational agent, it goes to alveoli. From alveoli it goes to, yes, blood and then brain. So we found that what is the minimum alveolar concentration, means the concentration of inhalational agent which make 50% patient unconscious. Okay, that is minimum alveolar concentration. If you can make patient unconscious with low dose, means it is having high potency. If you require large dose to make the patient unconscious, that is having low potency. So if minimum alveolar concentration is low, then potency is high. If low, MAC is low, then potency is high. So this is inversely proportional. Blood gas, yes, so potency is inversely proportional to MAC. Potency is inversely proportional to MAC, minimum alveolar concentration. What about, yes, which is most potent, least potent, I will discuss with a mnemonic. What is blood gas coefficient? Blood gas coefficient. What is blood gas coefficient? That is, means blood gas solubility. Means if gas is more soluble in blood, this will not go to the brain, means it will remain in blood. It will slowly put effect on the brain. So if solubility in blood is high, then onset is slow. If solubility in blood is low, then onset is fast. You can easily remember by this. Okay, now this classification gas N2O I made mnemonic NATO. Yes, now this is a very pathetic condition. You know that I support, yes, all my foreign medical graduate. Yes, I know this is a very painful time. Yes, but we should tolerate that pain and pray to God that sooner this problem is solved and then they will come to our country again. Yes, their own country. Yes, but for a joke I can say NATO has done, yes, carried Ukraine to this blast. NATO carried Ukraine to this blast. Yes, NATO means N2O is carrier gas. NATO was saying you can, but after that he left. Okay, yes, blast. So NATO blast, so megaloblastic anemia, N2O megaloblastic anemia. Whenever there is blast, there is expansion. So expand space. So avoid in pneumothorax. pneumothorax, pneumomediastinum, pneumoencephalopathy. Means wherever air space is there, yes, it will expand. You all know whenever there is bomb blast, expansion of space. This NATO is least potent. I would say that this is least potent. Okay? Yes, he said I can't. And yes, put the Ukraine. Yes, second gas effect. Okay, he put the, means he increases the desired concentration of fight in Ukraine. Means what is second gas effect? Yes, N2O increases the concentration of inhalational agent in alveoli. That is called second gas effect, and this NATO is doing the same work. And so much of blast, so much of inflammation, that's why it is, yes, it is inflammable. That's why it should not be used for laser surgery. Okay, yes, I am deliberately reading the LMRP of Dr. Ajay with mnemonic, so that yes, you must have read few topics, so that it would be useful for you when you will revise it fast. Okay, this also causes bone marrow aplasia, subacute degeneration of spinal cord, yes, megaloblastic anemia, destruction of ozone. Yes, now I am going to describe these four. These are frequently asked. You can make very simple mnemonic. HIS, his dream. Any mnemonic, his dream. So H, you will remember H, MAC. MAC is least MAC. If less MAC, more potent. Means only 0.75 is sufficient to make the 50% patient unconscious. So while desflurane S46 here is 0.75, so this is most potent. H4 halothane highly potent, while desflurane 6, MAC is 6, so least potent. So you can remember easily. So high potency, half, near half, means 0.75 is near half. So 0.75. Iso, matlab same, isomer are same. So you can say 1, 1, 2, 1 means point around points. These are same. Sevoflurane second. Okay. Now let me discuss one by one. Halothane is having high blood gas solubility, means it remain in blood, so it induce anesthesia slowly, and name itself tell you hello, hole chalo mere sajna. Okay, slow onset. H4 hepatitis, yes, immunogenic. Halothane sensitize heart to adrenaline. Sensitize heart to adrenaline. Okay, so halothane sensitize heart. Now desflurane, yes, desflurane is having disgusting smell. It means irritating. Okay, disgusting smell. It is having low blood gas coefficient, so it is fasted. So these are two opposite. Halothane high potency, desflurane least potent. Halothane hole, desflurane fast. So his D in this sequence you will say yes, high potency, max, yes, least potent. Slow onset, fastest onset, and you can easily remember. Okay, now isoflurane I will discuss. The mnemonic is there. For sevoflurane, by name itself you will remember S for sevo, S for sweet, the sweet odor. When it is sweet odor, you can give it is induction agent also. Yes, mnemonic is a sweet child. This sevoflurane, fluoride is toxic. fluoride make compound A. This compound A is nephrotoxic. Compound A is nephrotoxic, and the MAC is second, Se4 second 2, and Se4 Caesar. So Se4, yes, you can easily remember Se Caesar, Se second, S4 sweet, okay, and a sweet child compound A, yes, like this. Desflurane, this is fluoride, yes, means D fluoride, deficient of fluoride, means it produce least fluoride, least metabolism, means least interaction. That's why this is the inhalational agent of choice, because least interaction. Okay, so you can remember like this. Now I read this, the notes. Yes, the purpose is you can revise the LMRP very fast. Genone advantage is no side effect like nitrous oxide, yes, but it is very expensive. Okay, sometimes it can increase airway increase airway resistance, so we avoid this in asthma. What is about halothane? Halothane, yes, I have already discussed halothane, yes, cause hepatitis, immunogenic H4 hepatitis, heart sensitization, yes, holy, slow recovery, slow onset, yes, most potent, highly potent. Isoflurane, yes, isoflurane irritate, I4 irritating induction. So you will remember, yes, this is irritable, disgusting smell, so not for induction. It should not be used for induction. Clear? Now desflurane, yes, desflurane, I told you, least metabolism, least interaction, okay, least potent, fast action, yes, no fluoride. Now sevoflurane, this is inhalational anesthesia of choice for save plant. Mnemonic is save plant. P for pediatric, L for liver, hepatic patient, A for asthma, N for neurosurgery, yes, T is silent. Yes, save plants. Okay, and you will remember side effect by A, B, C, because it, yes, it is A compound A, produce compound A which is nephrotoxic, B for burn, C for convulsion, or SE for seizure, you can remember. Ether I have already told you, this was first demonstrated by Morton, yes, and it is cheap. Advantage is that it is cheap and it is complete anesthesia. Disadvantage, it is inflammable and irritating. Heliox, yes, it has, helium is having very low density, so whenever we want, yes, if upper airway obstruction is there, we can use Heliox. Antonox, this is not Etonox, Antonox, I have told you, if you count the letter 7, pin number is 7, labor analgesia, Antonox. So you will remember mnemonic, save plant, sevoflurane, these are the questions. Now desflurane, you will remember like this, his, HIS, his D, dream, his dream, okay, H, high potency, hole, hepatitis, so you can do like this. So maintenance. So today we have covered three things. Yes, anesthesia in general, yes, these, in this you will find most of time question on McGill circuit or Maffelson circuit, and there, yes, controlled ventilation, spontaneous ventilation, Srivalli, yes, these pictures will help you. Okay, second thing, yes, then we discussed about this, yes, this is Mortin, This is John Lundy, Johnny Walker, Johnny Lever. Yes, this is August Beer, spinal. In spinal, subarachnoid space is given. Then, yes, this is the protocol: pre-oxygenation, induction, maintenance, and reverse. IV agent, in their name itself tells you many things. Names: thiopentone, pain, if intraarterial, 10, half-life, 10, pH, okay. Anticonvulsants, okay. Because yes, propofol, all means alcohol है तो egg भी आएगा, and yes, चखना भी आएगा, सोया भी आएगा. सोया oil जहाँ पे भी oil होता है painful होता है. Yes, and if soybean, that the bacterial contamination, so if you open a oil, use within 6 hours. It is unique property, antiemetic. Yes, etomidate, if you go for date, your kidney is sold to gift your girlfriend. Yes, iPhone, and not kidney, additional expenses would be there. Yes, add renal, okay. Suppression, ketamine, all pressures are increased, kata, kita, dissociate kiya, hallucination, okay. So these are, yes, other opioid, yes, and these are not so important, in fact important, but we have limited time, so keeping in the mind that we have limited time to revise important aspects, and that inhalational agent, very common, yes, and 2 as NATO, and then these save plant, and this, yes, their name itself will tell you so many things, okay. D for disgusting, okay. Mac, halothane. So this in this way you can revise, okay. So we will try to cover all the 19 subject of e-Gurukul LMRP notes. Yes, and yes, I will be the only person who will do that. I know that I am not faculty of all subject, and that's why I say that I will do chanting with the help of expert notes of expert person, okay. So best of luck, take care. We'll meet on Thursday. The remaining part of anesthesia would be covered at that time. Okay, thank you.